Thank you all for joining us today. It's a pleasure to be with you all today. This is the Children's Safety Network, and we welcome you to our webinar on the LGBTQ plus youth data from YRBS and beyond. So the Children's Safety Network is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Center's Cooperative Agreement. This information or content and conclusions are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. The speakers and data presented today are not funded by HRSA. Just some tech tips as we get started. Please join your audio by computer if possible. If you experience any audio issues, you can use the phone number found in the Zoom invitation and mute your computer speakers. You are muted, but you can always use the Q&A button found at the bottom of your screen to ask any questions. The session is being recorded and will be publicly posted on our website. And the closed captions can also be viewed by clicking on the CC button at the bottom of your Zoom screen. And we will share any resource files and links in the chat. And with that, I'll hand it over to Dr. Alex Karuglian, who is our moderator for today.
Thank you so much, Maria. Hi, everybody. Great to be with you all and looking forward to today's webinar. I would like to just briefly introduce myself. I'm Alex Karuglian, any pronouns. I'm an associate professor of psychiatry at Harvard Medical School. I direct our Division of Public and Community Psychiatry at Massachusetts General Hospital, and I practice at Fenway Health, which is a federally qualified health center in Boston, where I direct the National LGBTQI+ Health Education Center at the Fenway Institute, and I'm an active member of the CSNA. I'd like to welcome our presenters and just want to mention that their full bios are on our website. You can read their full bios there. Nicholas Suarez, he, him, is a health scientist with the CDC's Division of Adolescent and School Health, DASH, where he leads the DASH research portfolio on creating safe and supportive school environments. His research focuses on LGBTQ+ inclusive practices in schools and the benefits of these practices on the health, well-being, and safety of both students with LGBTQ+ identities and the general student body. In light of the disparities in suicide-related outcomes, experiences of violence, and poor mental health faced by transgender students, he's committed to researching strategies that advance health equity for transgender and gender diverse young people. Nick received his Master of Public Health from the University of Michigan with a focus on health behavior and health education. Dr. Ronita Nath, she, her, is the Vice President of Research at the Trevor Project, where she leads the organization's research endeavors on the mental health of LGBTQ+ young people. Her expertise lies in LGBTQ+ health, research methodologies, sexually transmitted infections, and adolescent health, with a particular focus on the intersections of race and ethnicity. Formerly, Dr. Nath was the managing director of the University of British Columbia's Stigma and Resilience Among Vulnerable Youth Center, overseeing national and provincial wide series on the effects of stigma, violence, and trauma on LGBTQ+ youth. Prior to her role at UBC, she was a James Krepner CTN postdoctoral fellow at the British Columbia Center for Disease Control, where her research sought to understand factors contributing to the province's syphilis epidemic. I'll now hand it over to Nick to get us started.
Thank you, Alex, and good afternoon or good morning, depending where you all are. It's great to be here. I will be presenting on our use and promotion of the Youth Risk Behavior Survey for LGBTQ+ equity. Next slide, please. So just to give you an overview, today I'll be first giving you a kind of background around the Youth Risk Behavior Surveillance System, or the YRBS. I'll highlight some of the recent data that we have and experiences of students with LGBTQ+ identities, and then I will end my portion discussing some of the school-based data collection challenges and some strategies to overcome them. Next slide, please. So just to begin with the overview of the YRBS. The YRBS, or YRBSS surveillance system is a set of surveys that monitor health-related behaviors and experiences among adolescents. The behaviors are selected because they contribute to leading causes of death and disability among youth and adults. The system has two main components: the national YRBS, which is conducted by CDC, and the state, territorial, tribal, and local surveys that are conducted by state and local agencies and tribal governments. Collectively, we refer to the states, territories, tribes, and school districts that conduct the YRBS as sites. So you'll hear me use that term throughout the presentation. Next slide, please. This slide just shows a few of the topics covered by the survey. This includes student demographics, including age and race and ethnicity, as well as health behaviors and conditions, including those related to injury and violence, mental health, diet, physical activity, substance use, including tobacco product use, alcohol and other drugs, and student experiences such as unstable housing and exposure to community violence. Next slide, please. So just to first discuss about how the national YRBS works, the CDC starts by drawing a nationally representative sample of students in grades 9 through 12. This is including students in both public and private schools. The survey is completed completely anonymously and is conducted on tablets. The survey is administered in the spring of every odd numbered year, so 2023, 2021, and so on, and is completed in a single class period. The questionnaire has about 100 questions and is available in both English and Spanish. Next slide, please. Moving on to the site-based youth risk behavior surveys, the CDC then funds sites to conduct their own individual youth risk behavior surveys that are separate from the national YRBS. Through these surveys, sites can compare their data to data from other sites, as well as data from the national YRBS. Like the national YRBS, the site surveys are conducted every other year among students in grades 9 through 12. While the national survey includes students in both public and private schools, the site-specific surveys only survey students in public schools. While the national YRBS is now administered entirely electronically, sites have the option of choosing electronic or paper and pencil data collection. And finally, while the national YRBS uses a 3-stage cluster sample design, these site-specific surveys use a 2-stage design to get a representative data of each jurisdiction. Next slide, please. And so this slide is just showing a visual of the states and local school districts that are participating in the Youth Risk Behavior Survey as of 2023. Next slide, please. So each cycle of the YRBS, again, the odd number years, the CDC develops 2 questionnaires. The first is the standard questionnaire, which is the starting point really for all of the sites doing their own YRBS. The second questionnaire is the national questionnaire. It is largely the same as the standard questionnaire, except that it includes about 20 additional questions that are of particular interest to CDC or are required of all federal surveys. Next slide, please. And now just to spotlight some of our LGBTQ plus focused questions. First, I want to give you just a little background around the sexual identity and sex and sexual context items. So both of these items are measuring aspects of sexual orientation, identity, and behavior. For the sexual identity question, that question is as follows: which of the following best describes you? Between 2015 and 2019, those response options were heterosexual or straight, gay or lesbian, bisexual or not sure. And then beginning in 2021, instead of the not sure response option, we now have 3 different options, including I describe my sexual identity some other way, I'm not sure about my sexual identity or questioning, and I do not know what this question is asking. The sex and sexual context has not changed really since it started, and that is asking during your life, with whom have you had sexual contact? I've never had sexual contact, males only, females only, or both males and females. One or both of these questions have been asked on some state and local surveys since 1995. Both questions have now been on the standard and the national YRBS questionnaires since 2015. Next slide, please. The transgender identity item is a bit newer to the YRBS. It reads as follows: some people describe themselves as transgender when their sex at birth does not match the way they think or feel about their gender. Are you transgender? With options of yes, I am transgender, no, I'm not sure if I'm transgender, and I don't know what this question is asking. We started asking this question on some individual state and local surveys since 2017, when it was first piloted. It's now been included on the standard and the national YRBS questionnaire since 2023. Next slide, please. Now I just want to highlight some tools for accessing the data if you are interested and curious around how to analyze data on your own. The first tool I want to highlight is the YRBS Explorer. This tool is great for whenever you need a quick data summary for different behaviors. It's straightforward, easy to use, and you don't really need any data experience or background to use it. You can produce data summaries across the behaviors assessed in the YRBS by student demographics of sex, race, sexual identity, sex of sexual context, and as of 2023, transgender identity. You can view graphs and tables at the national level or looking by individual sites, such as states, local school districts, although the availability of data by sexual orientation and gender identity will vary by jurisdiction. Next slide, please. If you want to do some additional comparisons between groups, but you don't feel comfortable conducting your own analyses, the Youth Online tool is a great resource. When selecting data, you can choose between the national data and specific states, territories, local school districts, and tribes. Not all jurisdictions will have data available, and the 2023 data are not yet currently viewable with this tool, but that is in progress and should be updated fairly soon. You can also opt to look at data for a specific year or a specific question, and you can choose demographic characteristics by which you want to compare students, including sexual identity and sexual contacts. And again, once it is updated with the 2023 data, that will also include transgender identity. From here, you can also select to look at an additional location's data to compare data between jurisdictions, or you can look at additional year of data for the same location. So if you want to compare 2021 and 2023 in the national. Next slide, please. So with the kind of YRBS background and some intro into our tools, I want to move into highlighting some recent data around experiences of students with LGBTQ+ identities. Next slide, please. So this first study I want to highlight, titled Trends in Violence, Victimization, and Suicide Risk by Sexual Identity Among High School Students, was looking at YRBS data at the national level between 2015 and 2019. So that comprised 3 different survey years of 2015, 17, and 19. This was published back in 2020. And what we found was that while there were few changes over time, so really not much of a trend going on, or a significant trend for LGB students, lesbian, gay, bisexual students, there were disparities for LGB students compared to heterosexual students. LGB students in general had greater odds of feeling unsafe at school, being bullied at school, experiencing persistent sadness and hopelessness, or seriously considering suicide. And you can see that on the graph on the right, with LGB students, the blue line above, and heterosexual students, the orange line below. On the next slide, please. We also found that there were some differences that existed at the intersection of sex and sexual identity, as well as by race and ethnicity and sexual identity. On the left, we can see gay and bisexual males in blue compared to lesbian and bisexual females in orange, that gay and bisexual males were more likely to miss school due to feeling unsafe, whereas lesbian and bisexual females were more likely to feel persistently sad or hopeless compared to gay and bisexual males. In the next slide, please. We also found similar differences by the intersection of race and ethnicity and sexual identity, where we see that Black and Hispanic, lesbian, gay, and bisexual students were more likely to miss school due to feeling unsafe. And this is comparing Black, lesbian, gay, bisexual students in the blue line, Hispanic in the orange line, and then white, lesbian, gay, and bisexual students with the gray line. On the right, we'll see that white, lesbian, gay, and bisexual students were actually more likely to seriously consider attempting suicide than their Black and Hispanic counterparts. Next slide, please. Now, to discuss disparities by transgender identity, previous reports that were using the 2017 and 2021 site data, so this was the state YRBS and local school district YRBS, found that there were significant disparities between transgender students and students who are not transgender. Back in 2019, when the report on the 2017 data was released, we found that almost 2% of high school students were identifying as transgender among the states and school districts that were collecting this data. And we found significant disparities for feeling unsafe at school, being bullied at school, and attempting suicide. Next slide, please. More recently, we have been able to collect data and present on data among lesbian, gay, bisexual, transgender, and queer questioning, or LGBTQ+ students. In the data summary and trends report available from CDC, looking at data from 2013 through 2023, so the preceding 10 years, presented results for students with LGBTQ+ identities for the first time, comparing cisgender and heterosexual students. In this report, we do not break out by specific identities, but we did find that there were disparities for LGBTQ+ students at large across violence, mental health, and suicide. And just to note, this is the data summary and trends report, but since there was not enough waves of data where we're collecting LGBTQ+ identities, we can only really look at that as a cross section. So in 2023. Next slide, please. Now, some very exciting news in the past couple of years. Since the 2023 YRBS is the first time that the transgender identity item has been included on the national survey. This is the first time we're really able to report on experiences of students with transgender identities nationwide. We found that about 1 in 20 students identified as transgender or questioning if they're transgender in 2023. About 3% of students nationwide identified as transgender, and approximately 2% reported they were not sure if they were transgender. Next slide, please. Through this study, we identified disparities across multiple outcomes compared to students who are not transgender. Now, this isn't particularly new or surprising, as we had been seeing these sorts of signals in the state and local data since 2017. But being the first time that we conducted this at the national level, this is also really important data to publish. We found that transgender students are at highest risk compared to cisgender students for not feeling close to others at school, at 36.6% only. Being bullied at school, 40% of transgender students reported being bullied at school. Having poor mental health in the past 30 days, and seriously considering suicide in the past 12 months, approximately 53% of transgender students. Next slide, please. And so now just to kind of close off with some discussion of data collection challenges and strategies. Next slide, please. You may have heard multiple states have decided to stop participating in YRBS since the 2023 cycle. Each state was receiving federal funding to administer the state YRBS, but has since terminated the agreement. This is in addition to a handful of sites that were already not participating, as you saw on the map I presented earlier. The policy landscape in states affects whether or not states can participate. However, it is important to note that the national YRBS is not directly affected by individual states refusing to conduct their own YRBS, because CDC recruits schools to participate directly for the national survey. Next slide, please. On this slide, we see a continuum of what individual YRBS coordinators find when they're approaching schools in their sample about participating in their local YRBS surveys, a process that we refer to as obtaining clearance. Starting on the left, we might see that the process goes quite smoothly. And as you move along the continuum, you'll see sometimes the school needs some questions answered before they agree. However, these are mostly logistical questions in nature. Sometimes, however, things can be a little bit more difficult, and schools have more philosophical questions. These schools require ample time for negotiation before they are on board for participating in the YRBS. And finally, on the right-hand side of the continuum, there are sometimes schools in which there is organized opposition. If this opposition is not handled strategically, it has a potential to derail the survey. Next slide, please. So just to provide some examples of these concerns, some logistical reasons include having too many surveys at the school and feeling overburdened in that regard, not seeing an alignment with the academic mission of the schools. Sometimes there are scheduling conflicts with spring break, holidays, field trips, assemblies, and of course, being that these are conducted in the spring, this might also coincide with the end of the school year for some schools. Often these are mostly around not having enough time to do the survey. Next slide, please. On the other hand, philosophical reasons are a little bit more complex and have some more to do about opposition to surveys in general. They might be a little bit more challenging to address, such as you might hear things like, if you ask kids about it, then they might do it, or kids won't answer honestly. Next slide, please. When disinformation is a problem, it's important not to repeat it. Instead, the approach should always be to just state the facts. Here's some language that has been shown to be helpful, such as emphasizing that the survey is voluntary and anonymous. Any student can opt out of any question on the survey, and emphasizing the importance of the YRBS. The YRBS helps keep kids healthy and safe. It leads to data policy. The data leads to policy changes that protect students from sexual abuse, physical injury, drug, alcohol, and tobacco use, and suicide. Next slide, please. And lastly, I just want to kind of highlight some ideas around survey promotion. It's important to help students and local communities understand why the survey is being conducted and explaining how the data will be used in a way that will benefit them. It's also critical that folks understand that these surveys are completely anonymous and that the answers of students provide cannot be tied back to their names. So when you hear these questions, why is it important? How will my data be used? Who will see my answers? It's important to really be able to reply back with clear understanding of these are completely anonymous surveys and they're being used for the benefit of the health of all youth. Next slide, please. And with that, that wraps up my portion. So I will hand it back to Alex. Thank you.
Thank you so much, Nick. Hi there. Thank you so much, Nick. That was fantastic. And I want to remind folks that they can put their questions into the Q&A throughout. We'll have time for questions after the presentations. A lot of great questions already. I'm now going to hand it over to Renita.
Hi, everyone. I'm Renita Nath. I'm the Vice President of Research at the Trevor Project. The Trevor Project is the leading suicide prevention and crisis intervention organization for LGBTQ plus young people, and I lead our research division at Trevor. I'm excited to be here today and to share with you some of the key findings from our 2024 U.S. National Survey on the mental health of LGBTQ plus young people. Next slide, please. So for our national surveys, we collect data from 13 to 24-year-old LGBTQ plus young people across the U.S. For our 2024 national survey, which is it's a confidential online survey the young people can take from anywhere. We did our recruitment in September to December of last year, and this was through targeted ads on social media, including Instagram, Facebook, TikTok. We try really hard to ensure we have a diverse sample so that we can do subgroup analyses. And the way we are able to recruit that's diverse samples by focusing a lot of our recruitment efforts on harder to reach groups. So the online survey itself has a maximum of 134 questions. And by the end of our data cleaning, we had a sample of 18,663 LGBTQ plus participants. More than half of the sample consisted of trans and non-binary young people, and 40% were youth of color. Next slide, please. Okay, so just going to the results. Next slide. We'll start off with mental health and suicide risk outcomes. Okay, so this year's survey results showed that suicide risk remained high among LGBTQ plus young people in the U.S. Specifically, our survey found that nearly 40% of LGBTQ plus youth seriously considered attempting suicide in the past year. 12% reported attempting suicide in the past year. And these rates were higher for trans and non-binary young people and also for youth of color. Next slide, please. So we looked at differences across age, and we found that rates of considering and attempting suicide in the past year were significantly different across the younger and older age groups, where younger LGBTQ youth ages 13 to 17 reported higher rates of both considering and attempting suicide than our older LGBTQ plus participants who were in the 18 to 24 age group. And next slide. And then looking across sexual orientations, you can see here that pansexual young people did have higher rates of considering and attempting suicide in the past year compared to young people who reported other sexual orientations. And next slide. And here we're looking across gender identities. So here we see that trans men and boys have reported the highest rates of considering and attempting suicide, while cisgender men and boys reported the lowest rates of both those outcomes. And next slide. And then this slide is looking across race and ethnicity. Here we see that Native and Indigenous LGBTQ plus young people reported the highest rates of considering and attempting suicide in the past year, while the lowest rates were reported by Asian American, Pacific Islander LGBTQ plus youth and white LGBTQ plus young people. And these differences between groups remain for the most part across the other outcomes we looked at. So go to the next slide. We asked about symptoms of anxiety and depression in the past 2 weeks. 66% of participants reported experiencing recent symptoms of anxiety in the past 2 weeks, and slightly more than half reported experiencing recent symptoms of depression. We measured depression using the Patient Health Questionnaire, or PHQ-2, and anxiety was measured using the Generalized Anxiety Disorder Scale. And next slide, please. So going to the barriers of care, next slide. 84% of LGBTQ youth reported that they wanted mental health care in the past year. And despite this fact that suicide risk remains high among LGBTQ youth, as well as, high rates of anxiety and depression, and also the fact that, 84% wanted mental health care, only 50% who wanted mental health care in the past year were able to get it. So going to the next slide, where we look at the barriers to care. So here are the most common barriers that LGBTQ youth cited to accessing mental health care. And, while issues around access to care can certainly include tangible barriers, such as, having or not having insurance, the ability to afford care, like reliable transportation to and from care, our research illustrates how intangible barriers, such as stigma and fear, play a really major role in preventing young people's access to mental health care. You can see here that the most commonly cited barrier to accessing care was that youth were afraid to talk about their mental health care concerns with someone else. They're afraid they didn't want to get their parent or caregiver's permission to access care. They were afraid they wouldn't be taken seriously. They were afraid of being involuntarily hospitalized, or that someone would call the police on them. And so just really important barriers to note. Next slide, please. So we'll go into the risk factors for mental health and suicide risk. So firstly, looking at anti-LGBTQ plus policies, an astounding, 90% of participants said their well-being was negatively impacted by recent politics. And just to contextualize these findings, the year in which the survey was administered was a record-breaking year for anti-LGBTQ plus legislation in the US. Nearly half of trans and non-binary participants said their families had considered moving to a different state because of anti-LGBTQ policies and laws in their home state. Next slide, please. So we also asked about the participants' experiences at school. Many reported negative experiences while at school, including, being verbally harassed specifically because people thought they were LGBTQ+, not being allowed to dress in a way that fit their gender identity or expression, being disciplined for fighting back against bullies. And 9% reported that they'd experienced unwanted sexual contact because people thought that they were LGBTQ+. Next slide, please. So our survey found that many LGBTQ+ youth reported anti-LGBTQ+ victimization or being treated poorly, specifically because of their sexual orientation or gender identity. For instance, you can see here 23% of youth that reported that they had been physically threatened or harmed in the past year due to either their sexual orientation or gender identity, and that this rate was higher for trans and non-binary young people. Next slide. And then if you look at attempts of suicide across this variable, so those who had experienced being physically threatened or harmed due to either their sexual orientation or gender identity, they had more than 3 times the rate of attempting suicide compared to those who had not reported these experiences. Next slide, please. Looking at discrimination, so 60% of participants reported that they had felt discriminated against in the past year, again, specifically due to their sexual orientation or gender identity. This was, again, higher for trans and non-binary young people. Next slide. And then those who had reported these experiences of feeling discriminated against had more than double the rate of attempting suicide compared to those young people who had not reported similar experiences of discrimination. Next slide, please. So we also asked about conversion therapy, both formal and more informal attempts. And 13% of LGBTQ+ youth reported being threatened with or subjected to conversion therapy. Next slide. And those who had been threatened with or subjected to conversion therapy, they had 3 times the rate of attempting suicide in the past year compared to those who had not reported these experiences. And you can see that there was no difference in a suicide attempt if you looked at those who had been threatened or subjected to conversion therapy. Next slide, please. So we also asked about bullying in this survey, both in person and online. Nearly half of participants in the 13 to 17 age group, so those in high school, reported being bullied in person in the past year. And 26% of those ages 18 to 24 reported the same. So it was lower for those in the higher age group. And rates of online bullying were a bit lower than in-person bullying for both age groups. Next slide, please. So LGBTQ youth who experienced bullying of any kind reported 3 times the rate of attempting suicide in the past year compared to those who reported that they had not been bullied in the past year. Next slide, please. So, while this survey does contain, a variety of challenging and difficult to read findings, it also does point to ways in which, we can all support LGBTQ+ young people in our lives. So I can share some of that with you. Next, please. Yeah, so this survey adds to, a large body of research that consistently shows that LGBTQ+ young people report lower rates of attempting suicide when they have access to affirming spaces and affirming communities. For trans and non-binary young people in particular, gender-affirming experiences, such as having access to gender-affirming clothing, having access to a gender-neutral bathroom at school, having their pronouns respected, having access to binders and shapewear, these were all associated with lower suicide risk. Next slide, please. So through the survey, youth provided us with the top 10 ways people in their lives can show support and acceptance for them. And these included, trusting that they know who they are, standing up for them, looking up things about LGBTQ plus identities on their own to better understand, respecting their pronouns, showing support for how they express their gender, asking questions about LGBTQ plus identities to better understand, accepting their partners, showing support on social media, and having or displaying pride flags. These are just some of the things that they reported. And these findings, really tell us that you do not have to be an expert in LGBTQ plus topics and identities to show young people that you support and you accept them. Next slide, please. And here we can see that those who did report having access to these LGBTQ plus affirming spaces reported lower suicide risk overall, whether it was home, school, community events, online, or work that, where they reported them to be LGBTQ plus affirming, they had lower suicide risk. Next slide, please. And these are some of the community that they have identified as affirming. So, online spaces definitely were identified as the most affirming space among folks, followed by the school environment and then home. Next slide, please. And then you can see here that LGBTQ young people who reported living in very accepting communities attempted suicide at less than half the rate of those who reported living in very unaccepting communities. Next slide. Thank you. So for trans and non-binary young people, as I mentioned, gender affirming experiences such as having people they live with respect their pronouns, is associated with lower suicide risk. But that said, only 37% said that all of the people they lived with respected their pronouns. Next slide. And you can see that trans and non-binary young people who reported that all of the people they live with respected their pronouns, they attempted suicide, reported attempting suicide at about half the rate compared to those who said that none of the people in their household respected their pronouns. Next slide. We also have some data on the prevalence of LGBTQ plus role models. So most participants reported knowing at least one older LGBTQ plus person that they would consider a role model or someone they looked up to. And now, while the majority of them did say that it was someone that they followed on social media, it was nice to see that nearly 40% said it was a friend, 19% said it was another family member, 15% said it was a teacher. Next slide. So this is the last slide, and just want to leave on an encouraging note. So for the first time, we asked participants to share a message of advice or encouragement to other young people in their LGBTQ plus community. There were so many amazing responses, and I just want to share a few. One person said, you have millions of queer siblings across the world who would accept you for who you are. It is the most rewarding experience to live surrounded by people who love you for your whole true self. Another person said, you aren't alone, my friend. Remember, there's a whole wide world with people like you and me. And the last one I want to share is that the greatest act of rebellion is to go on living authentically and truthfully. Find spaces where you can be yourself unapologetically. That's it for me. Thanks, folks. Pass back to Alex.
Thank you so much, Juanita. That was fantastic. And we're looking forward to now having a discussion with our participants and answering questions. We've had a lot of interest already. And I'm going to start by asking Nick a question that we received. What can middle and high school students do to make the school environment more welcoming and safe for LGBTQ plus youth?
Nick, sorry, you're on mute.
Yeah.
Thank you. It wouldn't be a Zoom meeting without one of those faux pas. So some things that we recommend out of CDC for schools that are seeking to increase their inclusivity are primarily is implementing gender and sexuality alliance clubs. Those have been consistently seen in the research to be beneficial, not just for lesbian, gay, bisexual, transgender students and students with other LGBTQ plus identities, but also for the broader school environment, cisgender and heterosexual students as well. So GSAs are one aspect, and those are student-led clubs. We also recommend that schools are providing professional development to their staff around supporting youth with LGBTQ plus identities. And in particular, that schools are identifying safe spaces in the schools where students, including those with LGBTQ plus identities, know that they can go to find support from adults in the school environment. We're also evaluating and recommending schools to implement enumerated policies around anti-bullying and harassment, where they are specifically calling out anti-LGBTQ plus bullying as a kind of covered status, since that is not federally mandated. And then one other thing I'll highlight is just around schools adopting positive behavioral frameworks as opposed to using punitive systems. So where schools are really looking at the positive behaviors and setting positive behavioral and expectations for all their students.
Wonderful. Thank you, Nick. Renita, perhaps you can take the next question. That's a bit of a methods question. What advice do you have for folks trying to collect and use data about LGBTQ plus youth at the local level?
Yeah, that's a really great question. I think, with this data, I think firstly we have to ensure, privacy and anonymity of our participants, because this is very, sensitive information. Some young folks are not out to their family members and so on. So use, self-administered surveys when possible, implement strict confidentiality protocols to protect sensitive information, use standardized inclusive questions, adopt validated questions for sexual orientation and gender identity that are age appropriate and inclusive of diverse identities. LGBTQ young people are not a monolith, and it's important to see the differences amongst the different sexual orientations and gender identities. And I think, it's very important to educate data collectors on LGBTQ plus terminology, sensitivity, and the importance of respectful data collection. Collaborate with LGBTQ plus organizations where you can to inform your survey design and implementation. Strongly consider intersectionality. So, collect data on other demographic factors as well, like race, ethnicity, socioeconomic status, to understand, intersecting identities and experiences. And I think be transparent, clearly communicate the purpose of your data collection and how it will be used to benefit LGBTQ plus youth. Yeah.
Wonderful. Thank you, Renita. Perhaps, Nick, you can take the next one. What can educators do to help the voices of transgender youth be heard as they were excluded due to a lack of data?
Yeah, thank you. That's a very important one. So really, kind of at large for the general student body, it's important to kind of elevate student voice and make sure that they're being heard at the district and the school level. And this is no different for LGBTQ plus students. So we at CDC recommend that schools have multiple options for integrating student voice in their decision making, whether that is through a youth advisory council or through school health advisory councils that are including both students and members from the community. But in particular, is really making sure that these advisory councils are reflective of the student demographic and the student population. And it may be that you're looking to specifically get the voice of LGBTQ plus students and making sure that they're represented. Some avenues might be working through the GSA at a school through the Gender and Sexuality Alliance Club to perhaps start recruitment there. But yes, thank you for that question.
Terrific. Renita, how about the following question. What's the next, when is the next Trevor Project survey being done? Important to monitor the changes in the current environment.
Yeah, so we're going to start recruiting for the next survey starting next year, February, and those results will be released the following year, so in 2026. Yeah.
Great. Okay. A question for Nick, maybe a clarifying question. How does the CDC determine what schools to recruit for the YRBS?
Sure. So it depends on the survey. So if we're talking the national or the individual jurisdiction surveys, for the national survey, that is a 3-stage cluster sample. So it is both looking to sample nationwide and within various states and schools in those states. Some characteristics that are looked at in the sampling frame are sex and race and ethnicity. And those are kind of the primary sampling characteristics and demographic characteristics.
Great, thank you. And Renita, perhaps you can take this one. We get feedback from our schools that school is for reading and math, not for mental health. Do you have any tips for helpful feedback we can give schools in this scenario?
Sorry, schools are for reading and math and not what?
Those are for reading and math, not for talking about mental health. Do you have any
Hmm.
tips for helpful feedback we can give schools in this scenario?
Right, for sure. And yeah, we want our children to focus definitely on the academics, but it is very hard for them to focus on the academics when they do not feel well and supported and visible and seen. My youngest came out, and it was they weren't. They stopped learning. They couldn't. They were so caught up with just how will I be perceived, that they were being bullied for who they were. But once they were just accepted and affirmed, and we had conversations with the school and parents, their reading and math took off. They were back to where they were before. And to see that firsthand was just so empowering, even though we see the research always saying, yeah, it is about reading and math, but they can read and do math when they feel, when they don't have to deal with all these other stressors that they're experiencing. You should be able to go to school and just learn like any other child and to thrive. And that's what we want.
Yeah, thanks so much for sharing that. Nick, do you have any suggestions for development of informative and resonating resource guides or social posts?
That is a great question. I don't have specific guidance around those, as I'm not kind of our resident communications expert. But what I will say on that is to make sure that you're involving young people in the creation of content that is geared towards them. And so again, maybe that is having youth advisory groups or boards that are kind of reviewing as you're in development and making sure that is responsive to their needs and not just what we think that they might be needing.
That's great. Thank you. Renita, how does the proximity to a metropolitan hub impact the data? Are rural youth more impacted by lack of affirming environments?
Right. So I think your rural youth, firstly, they generally experience, sometimes greater challenges than those closer to metropolitan areas because, there's less access to LGBTQ plus specific resources and support services. There are fewer, affirming spaces and community organizations. And, being closer to metropolitan areas can provide those greater opportunities for connection with LGBTQ plus peers and community, better access to LGBTQ plus affirming healthcare providers, and sometimes greater exposure to diverse and inclusive environments. So I think research has shown that rural youth are often impacted by a lack of affirming environments. Higher rates of depression, anxiety, greater social isolation, less visibility of LGBTQ plus identities. And fewer school-based supports like GSAs or inclusive curricula. And so something to be mindful of for sure for folks who are outside the metropolitan areas.
Great. Thank you. Nick, could you say a little more about some strategies for addressing school concerns that kids aren't answering the YRBS honestly, and so the data isn't reliable or useful?
Sure. Yeah, this is definitely a concern that we hear all the time. Of course, there is the consistent message that we put out that, the YRBS is completely anonymous. And so that might kind
Nick,
of
I think you're
reduce.
muted again or we're not hearing you.
Hello?
Oh, we
I
I'm
hear
not
him.
hearing you for
Am
some
I back?
reason.
Okay. All right. Am I still there?
Now we can hear you.
Yes. Okay, great. Thank you. So yeah, thank you for that question. It is something that comes up quite often. And, we can definitely reiterate that the survey is completely anonymous. And so perhaps, hopefully that is kind of alleviating some of that concern that students know that they can answer honestly. At the same time, we also do provide or conduct data quality checks in the YRBS data processing. So it's not simply just taking the raw data that we get from students, but making sure that it is consistent across, that we are kind of weeding out responses that are maybe in unreasonable ranges. If you put a very high weight or a very short height or something in those questions. So there are some other data processing checks that take place to make sure that we are identifying potentially fraudulent responses.
Thank you for that. Renita, are there data to show how many supportive adults and positive friends youth have and feel that they can go to?
There is, so we have a brief on this on our website on supportive adults. And I don't know the exact breakdown, but from our research, we know that, the difference of one supportive adult, just having at least one supportive adult who is accepting of your sexual orientation or gender identity is associated with a 40% lower odds of attempting of suicide risk. And that was huge for us. Like, just that one person that uses your pronouns, respects you for who you are, is that one safe person at school maybe that you go to, that has such a huge impact. And so, that's what we share often with folks, be that one person for somebody.
Great, thank you for that. And perhaps this goes to both of you. Why are rates for suicide attempts higher for trans youth in the YRBS data versus the Trevor Project data? Does this relate to sample bias among youth who have capacity to answer the Trevor Project survey?
Well, I can kick that off. I will say this is something that comes, with any sort of data collection, right? So these are all estimates. These are not, the kind of cold hard truth. And so we're never really going to get the true number from a single survey. We have to do continued repeated sampling to really understand what are the rates of behaviors. Of course, there is going to be different biases introduced by different methodologies. And so we might see some slight differences. When I was kind of looking through the data, they were still relatively close. It was, I believe, almost 50% of transgender students across both the Trevor Project and the YRBS that had attempted suicide, I believe. It was either that or considered suicide. So they're still kind of close. They're going to be slightly different because of methodologies. But Ronita, anything else you want to add to that?
Yeah, definitely. Everything Nick said for sure. And we're different in some ways, right? So the YRBS looks at the grade 9s to 12. We do 13 to 24-year-olds. We do on our website do a kind of a comparison with the CDC's YRBS using only the age range that they looked at. And the numbers are quite similar. But again, YRBS uses a nationally representative sample. We do use targeted social media recruitment. YRBS focuses on all high school students. Ours is LGBTQ youth only. And so, there's all these differences that can lead to the other differences we're seeing. And yeah, I think that's why we're seeing what we're seeing, but our trends are overall, the same.
Great. Another question for both of you. How can state health departments use YRBS data and Trevor Project data to support LGBTQ plus mental health?
I would say, especially as schools and districts are kind of planning their activities around supporting student mental health, it can be really helpful to look at the data and understand kind of where folks are at. What is kind of the baseline of mental health? If you have the local jurisdiction data available, that's one thing. If you don't have that available, but you can look perhaps at the data from your state or from a neighboring state, or, just looking at the national, right? Trying to draw as much as you can to understand what is the state of students' mental health as it is, as you're designing programs.
Yeah, definitely. Inform, use hopefully that our the point of, putting all this together is we hope that states use these survey results to, develop and implement LGBTQ plus inclusive policies in schools and other youth serving institutions. We hope that there's funding directed towards mental health services for sure and suicide prevention programs, and that there's training for educators and staff. So we hope that states are able to use the state in ways that, decrease the disparities. And we're also, releasing our state-by-state reports in March that look specifically at what's happening in each state, because we do understand there is a need not just to look at national data, but what is going on at the state level. And, we hope to respond to that in a few months.
Definitely. That's terrific. Another question, Nick, maybe you can start us off because you talked about disinformation quite a bit. Open to both of you. I'd love to hear more about how to address disinformation about student surveys and inclusion of questions on sexual orientation and gender identity, particularly when it's being spread on social media within online parent communities.
Yeah, it's difficult, right? I'm not going to sugarcoat that. It is difficult to really address the misinformation, especially as it's spreading online, where it can be kind of unchecked in a lot of ways. Of course, like as I mentioned earlier, our kind of main message is combat it with facts. Don't repeat it, and don't kind of propagate that misinformation, but just with the facts. Variations in sexual orientation and gender identity are normal, longstanding, and so it's nothing to be afraid to ask about. And yeah, it is difficult. It's also something just to remember that it's not just because you see it online does not mean that it's necessarily the majority opinion. And so it's making sure to also kind of get out there as well and make sure that you are kind of being part of the voice that is against those voices that are spreading misinformation.
Right. Perhaps last question, Renita, can you describe your educational and career path that led you to be in your current position? So we only have a minute or so if people want to know how you ended up in your role.
Oh, for sure. So I was working, 15 years ago with street youth in India, in New Delhi, India, and, looking at their mental health outcomes. And, so many young people had actually, been, had been kicked out of their homes because of their sexual orientation or gender identity, but they didn't have a term for this because it was, they came from very conservative communities. And, I realized this particularly in certain cultures that, this coming out process is very, very difficult, associated with a lot of stigma, particularly in collectivist communities. And so, I felt like a lot of their mental health outcomes and physical health outcomes were a result of this intense stigma and discrimination they had experienced, that had them to leave and live on the streets. And so I kind of took that back here and I started working with young people and again, and personally just dealing with some of this at home as well, kind of reaffirmed my path to pursue this research with the Trevor Project.
Wonderful. We're glad you did. Well, thank you so much to Nick and Renita for their wonderful presentations and discussion, and to the audience for submitting such thoughtful questions. We're very grateful to CSN and our organizers for this very special event. We'd like to ask you all to please complete the evaluation of today's session. The link is on the slide you see here, and Catherine will launch the evaluation for participants. Thank you so much to everybody, to the CDC, to the Trevor Project. We appreciate you filling this survey out, and be well.